Hi, welcome to Detours, Understanding Acquired Brain Injury. And today I want to talk to families you and those of you who are new to this. It's very likely you've been told recently that your loved one has a brain injury. What is that all about? You may have heard this from your your family member themselves, or you may have heard this from a doctor, you may have heard this from a therapist or something like that, and it's like we're trying to figure this out. And this is who this video is meant for. People try to figure out what's going on. The thing is, brain injury can happen in a wide variety of ways, and it has a wide variety of effects. It's important to understand that brain injury has a broad variety of effects on a person, and it may be a bit confusing. First of all, there are different types of brain injuries. There's the one we're all familiar with through TV, movies, stuff like that, and it's concussion. Now, concussion is also known as a mild traumatic brain injury. Now, that has to do with the initial assessment. It has nothing to do with outcome. Many people who have so-called mild traumatic brain injury have very serious symptoms and may have permanent symptoms for the rest of their lives. It's important to understand that mild is just a rating used by EMS and emergency room personnel. It's got nothing to do with prognosis or symptoms. It's clear to separate those two. And it may not always show on a CT scan or an MRI. If you're scanned in the emergency department, the CT scan is to look for neurosurgical emergencies, bleeds, major shifts, brain tissue due to fluid accumulation, things like that. But the damage that causes the changes that are significant long-term is microscopic. A CT scan is not good at seeing that, and frankly, neither is an MRI, at least in standard modes. There are special modes that can show things at a much smaller scale, but insurance doesn't pay for that. It's important to emphasize, insurance does not pay for those kind of scans that show the microscopic scale damage. So many people who have mild or moderate rated TBIs by the emergency department, you will not see that damage on the CT scanner or the MRI. So it's important to know, just because some scan says that we don't see anything doesn't mean there isn't injury or damage. Important to stress this. So you need clinical assessments like neuropsychological evaluation. You need to put that together with changes in behavior, emotions, cognitions, ways of thinking, reacting, changes in how a person's motor skills are functioning, things like that. So it's important to look at the whole patient. As we said in the emergency department, when I was working there, we often said, treat the patient, not the equipment. It's the patient that's, the one that matters. But a lot of new docs, nurses, things like that. I worked for 10 years in the emergency department as an emergency nurse and trauma nurse, as a trauma nurse there. And so that's where some of my experience comes from. I was also working on my PhD in neuropsychology. Almost was done. I was in a very bad car wreck, traumatic brain injury number 1, just so you know where I'm coming from. I also have my clinical, I have my certified brain injury specialist. So I do have background in brain injury, just so you know. I'm not, as they say, talking through my hat. I do have experience in this, and I work with brain injury patients. All right. So what are the kind of different causes for brain injury? Well, I'm going to use my brain injury model here just to help. There are different causes. Obviously, the most common we think of is the traumatic type. And traumatic brain injuries, anytime there's an external force that is applied against the brain, please know you don't have to actually hit your head against the surface. A good shakeup, and this is what concussion means, it's a good shakeup of the brain, and this causes microscopic damage, tearing and twisting and destruction of of both white matter and damage to the interfaces between white and gray matter. White matter is what's called myelinated. It's insulated, basically, and it is the connections between the areas. It's like insulated wiring that allows different areas of the brain to talk to each other, like an internet network. Damage to these white matter tracts, which are usually deep inside the brain, causes wide-ranging effects. And so damage to one area may cause impairments or dysfunctions in others, because it's kind of like knocking out the internet communications links between different areas. Gray matter is clustered areas of neurons that are very tightly packed together, and they do the local computations and analysis. And so they have highly specialized functions typically, or they do a lot of the associative thinking, the intuition, the deep thinking and problem solving like that, but they're required to be connected to other areas in order to perform their functions. All right. So concussion is shaking of the brain, and with concussion you often see microscopic bleeds, swelling, inflammation. You'll see changes in metabolism. You'll see interference with oxygenation of those areas for a little while. It's not prolonged, but it's long enough to cause further death. You see twisting, breaking, and tearing of neurons. So this has wide-ranging effects on the brain. Phenomena called diffuse axonal injury. See my video on diffuse axonal injury and some of the wide-ranging and serious effects that diffuse axonal injury can have. And again, because it's microscopic, may not show up on the scan. All right, that is concussion, shaking of the brain. The brain is very gelatinous. It's almost like jello versus the skull. And so changes in acceleration cause destruction to the brain by concussion. And symptoms of concussion can last a lifetime. You were used to thinking you can just shake them off and in a day or two you'll be fine, but we're finding there is a large group of people who suffer concussion from car accidents, sports, domestic violence, and they have permanent disabilities as a result. As I said, mild traumatic brain injury or concussion doesn't mean no symptoms or mild symptoms. Very severe symptoms quite often. Also, there's moderate and severe. Usually you see these in car accidents or falls. So these are where a person is unconscious for longer periods of time. In mild traumatic brain injury, you may not lose consciousness at all. Or concussions, you may just be dazed or confused. Whereas with moderate and severe, you may lose consciousness from some hours to days, weeks, months. Obviously, symptoms are very serious. We'll get into symptoms in a moment. Other causes: encephalitis, inflammation of the parenchyma, the brain tissue itself, meningitis, inflammation of the coverings around the brain, cardiac arrest, drownings, causing lack of oxygen to the brain, which causes similar damage on the microscopic level, and brain cells destroying themselves due to the lack of oxygen and the changes in the brain chemistry and inflammation. Toxic substances, certain like lacquers and paints and inhalation exposure, prolonged exposure, lead, heavy metals, certain drugs can be neurotoxic. Fevers can be destructive to the brain. Even subconcussive falls, we'll get into that later, but that's where you don't necessarily show symptoms after the concussion, but repeat hits to the brain can be. All right, so what are the symptoms that you can expect? Now, obviously, it depends on where in the brain the impact happens, and it depends on how severe the kind of injury, and also repeat injuries can be cumulative. All right, person with injury, damage to the front of their brain can have different types of symptoms. They can have what are called executive symptoms. These kind of executive dysfunction, executive symptoms deal with planning. They may have trouble organizing their day or organizing their room, organizing their house, whatever. They have trouble putting this together in their head because they can't think of the next step. They have trouble with this. It's not intentional, it's trouble. They tend to have problems with complex attention, moving their attention from task to task to task. It's another executive dysfunction. They may have problems with complex problem solving, mathematics, or just problem solving in their job or in life. Going out or shopping requires complex attention, complex problem solving like that. Their processing speed, how fast they think of what comes next, or understanding what's told to them. They may be much slower than they used to be and have to spend some time thinking. They may have, with frontal lobe damage, trouble with empathy, feeling for somebody else. They may seem cold and callous. They may seem self-centered, focused only on their own needs, wants, and not able to feel the other person's emotions. They may not understand that, you as a family member are in distress. They may not notice that you're crying or whatever. They may not care or seem to care. They have trouble with their own emotions many times. Again, this isn't everybody. This is just a certain percentage. They may be aggressive, impulsive. They may just act without thinking. They may say something. Hey, that lady's overweight. You need to lose some weight. Stuff like that. They may be willing to hit somebody because they're mad without thinking, maybe I shouldn't hit the police officer. Maybe it's not a good idea. They lack that kind of impulse control. They may seem to lack that emotional connection with family members. They may seem to not really know why this person's important. It's mom, I think, but why does it matter? That kind of stuff. There are rehabilitation techniques for all of these, but and there is recovery too, but it takes time. It takes a lot of time. Temporal lobe. And temporal lobe is on the side here. Both sides. It helps with sound processing, making sense, and helping with the production of speech, language, which is also a responsibility of the frontal lobe. On this side here, blue area, the production of words, understanding what is spoken, understanding emotional tone in words, helps processing emotions again, and assigning value to tone and speech. Person with diagnosed brain injury may have problems with recognizing famous faces and here, and assigning. It's kind of a strange side effect, but it can happen. Problems with creativity, and they may be able to, for example, play an instrument, but there's no soul, you might say, because there are issues of creativity and making those emotional connections. Temporal lobe, you see problems with memory, as well as the frontal lobe. Those two areas are connected, but short-term memory for frontal lobe damage, trouble accessing autobiographical memories and memories of the past, as well as storing and integrating long-term memories, damage to the temporal lobe, and those deeper kind of heartfelt kind of emotions. Again, temporal lobe. Then there is the parietal lobe back here behind the central sulcus, back in this area. A lot of your academic skills are associated with damage to that region. Reading, writing, mathematics, kind of comprehension and visual spatial recognition. So damage here is often associated with a person who has trouble, who loses the ability to read or write, and sometimes you'll get impairment and slowdown in reading or recognition of words, trouble finding words, trouble with speech, trouble with any of the academic skills. This is where damage here would affect your school skills and your raw intelligence. Decrease in IQ, any of those kind of things. Schoolhouse back here, but it also affects like your ability to dance, move. Again, that's partly integrated with the frontal lobe. because some programming and coordination comes through the frontal lobe as well, but a lot of the programming of movements between those two regions. So back there. Finally, occipital lobe is important because it processes visual information. If you have changes to your vision, some people can go cortically blind, damage back here. Even though their eyes work fine, they cannot process visual inputs, lose their sight, or it's altered. They may see patterns, strange patterns, or not be able to process those kind of inputs, or lose their color vision or something like that, or only see one or two colors, or they may not be able to process objects. It's called agnosia, and they may not be able to process what a key does or what a door is, or these kind of effects, especially between this region and linkage to the parietal lobe. People may have problems with processing certain symbols. Again, damage here may affect your skills in mathematics and, reading and symbolic logic and stuff like that. Cerebellum, down here. Cerebellum, we're discovering more about it, but we used to think it was just, if it was damaged, it affected smooth movement, the ability to coordinate for both fine and gross motor, but we're discovering it has effects on emotion and some higher level thinking. Those bits of research are being still figured out. Brainstem, white area, your basic functions, breathing, regulating heart, hormones, stuff like that. Reaching up into under here, hypothalamus, and your thalamus all the way up in there, which extends up in, and control of and regulation of flow of hormones, and your control of things like blood pressure, and by working with brainstem, as well as also hormonal signaling. Brain injury can affect growth hormone, and so affects how well you heal after an injury. So some unusual problems like that. It affects sleep, and one of the ways it does that is by altered hormonal secretions. So testing by an endocrinologist or something like that may be necessary, and it may affect, like, you may be more prone to fractures because of failed secretions of specific hormones. You may, if this is in a child, they may not grow as they're supposed to due to damage here. Problems with blood pressure because of damaged signaling from this region. So it's important to bear in mind that damage to the brain can affect just about everything. And many symptoms, it's important to know, hey, this is coming from brain injury. And rather than say, oh, you're faking it, you're not, be supportive and direct the person towards an appropriate medical professional. If this member of your family has brain injury, you need to say, hey, you need to see a doctor if you're having symptoms like this. Or if somebody hasn't been seen by EMS or in the emergency department, maybe they need to talk to a neurologist or a physiatrist, a physician who's a specialist in rehab medicine, or a sports medicine physician, pretty obvious what they do there, who's a specialist in concussions. And a number of sports medicine physicians are specialists in concussions, and they can help with this kind of thing, and they may refer to a physiatrist or a neurologist, specialist in the nervous system. What is important to know is that many of these kinds of doctors are not necessarily specialists in brain injury medicine. There is a subspecialty, which means it's even more focused in brain injury. And you'll need to look up these kind of doctors. And they're usually found in major urban centers. They're found in large hospitals. So you have to look and ask and call, hey, do you have a brain injury medicine physician who has to be either a psychiatrist or neurologist or a physiatrist? Okay. Now, what are things you can do at home if somebody has suffered a brain injury of some sort, regardless of cause? You can maintain for them a daily routine, and this helps this person feel more secure, regardless of the cause of brain injury. You can make sure that objects that they'll need are easy reach, because many people with brain injury have trouble with coordination. Make sure they rest frequently. A lot of people with brain injury, in fact, the vast majority of us, have neurofatigue. I make my videos mostly in the morning because I get tired throughout the day. Be natural. So, just treat them as though they're uninjured, as best as you can. Obviously, there'll be some changes, but try to let them feel as much as possible their role in the family. Obviously, the more serious damage, those disinhibition, aggression, things like that with kids or something like that, you may need to make some modifications, but as much as possible, let them feel their previous role in the family. Communication is critical. They may not be able to talk, but they should still be involved in as much as possible in the family life. Very important. They need to be included in activities and conversations. They may have disabilities, but they're still members. And, even if it's just you and the brain injured person, if you're the sole caregiver, they still need to be included. Really important. It's easy to put them out, and sometimes they have behavioral problems still, if possible. Maybe a photo album with labeled pictures, familiar places, stuff like that, if you can find it, and go over it with them. Or digital photos, and talk with them about it. Ask how you think this person is feeling. This is important for empathy. And watching movies with them that are tearjerkers or like happy movies and stuff. How's this person feeling? How are you feeling? How would you feel in their shoes? To help work on that empathy is important. Or how could you help in this situation? Especially if it's like a family kind of movie or something like that. If you were in that position, how might you be able to help? And reinforce those kind of behaviors. Also reinforce them if you see them doing good. If you see them doing something positive and they're having some problems with empathy, ask them how they're feeling. Have them identify their emotions. And have them identify feelings in other people by faces and things like that. And even if they're struggling a little bit, it's like, well, what can you do? So-and-so is struggling with a lot of grocery bags. What could you do to help? Carry them? Yeah. Stuff like that. All right. Point out stuff that they've done, gains that they've had since their injury to make them feel, talk to them like their age. If it's a teenager, talk to them as you would any other teenager. If they're an adult, you talk to them like an adult. Don't talk to them like they're 6. Okay, it's really important. Even though they may act that way, and this is hard, I understand, but as a medical professional, it's like telling you this is important because you then will get more of that kind of behavior out of anger and frustration. Respect what they like, don't like how they're dressing, even if it's different, because many people after a brain injury do have personality changes, and so urging that. If they have memory problems, again, just spell out, like what you're going to do, break it down into simple pieces and spell it out. And then remind them later if they need a reminder. Make it simple. Many people with brain injury, we become overstimulated. So, just reduce how many, if somebody's visiting like in the hospital or they're visiting at home, if you got guests or something, don't invite the whole family. Maybe just 1 or 2. Take it in pieces. It doesn't mean don't have people visit. It just means 1, maybe 2. Just this couple, or just have the kids over. Something, just much smaller scale, so they don't feel overwhelmed because they may end up shutting down. 1 person talks at a time, taking turns. Short sentences, basic words. If you need them to do something, 1 command at a time, 1 instruction, and be direct. Avoid figurative language. So avoid the sarcasm, the idioms, that kind of stuff, especially early in their recovery process. And a lot of people with frontal lobe injury will never understand it anyway. They'll never regain that. Not all, again, this is many, but not all. So, nice job when they mess up or something like that. Don't do that. They're not going to get it anyway. They'll literally think you mean nice job. So don't do that. Again, not everyone has that. And those who have it don't have it all the time and sometimes may recognize it. But for the most part, just say what you mean. And try not to, make a big deal if they mess up. They will get better over time. But this is important, to help and be supportive in the early days. If they get angry and aggressive, You need to not reinforce that kind of behavior, though. So walking out, if it's safe, walking out, leave, tell them why. I will not be talked to that way. You cannot yell at me. You cannot try to hit me. Not acceptable. You don't want to reinforce or give in if they get like that, because that will teach them that it's okay to hit, bite, kick, spit, any of that kind of stuff if they have those aggressive behaviors. Or if they yell a string of cuss words at you and say, when you calm down or whatever, then we'll talk again about what's bothering you. Respecting that they're feeling angry or irritated, but not respecting bad behavior. Disability is an explanation, not an excuse. As far as their safety, keeping clutter out of the hallways and stairs, make sure they're less likely to fall, because another hit to the head could make things much worse. Get breakables and dangerous things like guns, matches, knives, any of that stuff out of their room and out of the space that they can easily get to. Don't give them OTC medication or anything, even herbs and other things without the doctor knowing, because many of these things do interact with medications they're on, anticonvulsants or blood pressure meds and other things, and that can make them worse. Secure basement doors. You don't want them falling down the stairs with like an extra lock or something. Any place there's medication or other things, lockable. Secure. Keep the bed low. You don't want them rolling, falling out of bed, hitting their heads. Make sure like places they are well lit, but not oppressively so. Like good quality lights at a good level. Just if they're confused and they're still home early, they're early from the hospital, maybe somebody to sit with them so they don't wander and stuff like that. Secure your exit doors at night. Make sure they're locked. You don't want them to go wandering. A lot of cases of brain injured patients just wandering off and finding them frozen to death or finding them dehydrated and in trouble from the heat. Maybe, a mat alarm. They sell these. You can get these at medical supply stores if they're a person who wanders. Just, cords. Watch out for electrical cords, stuff like that. Make sure that's secured in a way so they don't trip and fall. Again, like I said, sharp objects, guns, all that kind of stuff, locked and secured. Many of these things are for early or for more severely disabled people, but even some people, mild traumatic brain injury, may have problems with these. A mild acquired brain injury. Report changes in conditions. So if somebody is doing at a certain level and then suddenly they get worse, report this to their physicians, their treatment team, because there may be something going on. They may have a bleed, they may have swelling, they may be having regression, they may be having a progressive neurological problem. Report changes is important. Generally work with a medical team as best as you can to help. And they'll give you advice. The therapists, the doctors, the nurses, they're on your side, even if they seem like they're not, because many times they're going to push the patient to do things they don't want to. And the patient will get angry, irritable, say stuff. It's just the way it goes sometimes. And if you feel like you're getting the wrong answer or something, don't hesitate to seek a second opinion. That's important too. If you've got questions, ask the doctor, ask the PA, the NP, whatever. Ask the nurses, they know stuff too. Ask the therapists, the psychologists. They're on your side. But it is important to do these things to help support the survivor and to help keep the family together. I know this video is kind of long, but I feel that these are kind of the basics. These are foundational stuff, and then there's more details elsewhere. Hope you liked the video. Hope you found it helpful and useful. Please don't hesitate to put comments below and questions you may have. Click like, subscribe. Click the bell icon if you want to see more like this. And hope you have a good day, and we'll be back with more.